Welcome to another educational video regarding the urinalysis and the urine microscopic. In this video, we will delve into the intricate details of urinalysis, considering the microscopic tests and their implications for medical professionals. Please note that this video is for educational purposes and there is no intention or suggestion of diagnosis or treatment. This video may assist you with speaking with your healthcare provider and empowering you to be a knowledgeable health advocate. Let's begin with the physical examination of urine. First, we'll focus on the color and appearance of urine. Different colors and appearances provide valuable insights into your bladder and kidney health. For instance, if urine is red, it might indicate hematuria, hemi, referring to blood, and urea, meaning presence in urine. However, the usual color of urine should be yellow, slightly yellow, or clear. Also, the appearance of urine should be clear to slightly cloudy. However, cloudy urine should be examined further using a microscope. The clinical laboratory scientist will view the urine under the microscope to see what is making the urine cloudy. Next, we delve into the chemical examination of urine, which gives the provider even more insight into a patient's health. The pH level of urine is an important piece of the analysis. The pH scale ranges from acidic to alkaline. In general, an acidic pH is less than 7 and an alkaline pH is higher than 7. 7 is considered a neutral pH. In a healthy person, the urine is slightly acidic, with a pH of 5 to 6. A lower pH level may indicate various conditions, such as dehydration, fat metabolism, acid-producing bacteria, or diabetic acidosis. A high pH, higher than 7, may indicate other conditions such as a diet high in vegetables, ammonia-producing bacteria, low-carb diet, chronic kidney disease, or renal tubular acidosis. Moving on, we look at specific gravity, which measures the ability of the kidneys to concentrate urine. Basically, specific gravity shows how dense the urine is. The urine's density is then measured against the weight of water, which has a specific gravity of 1.000. This number is essential in assisting the provider towards diagnosing conditions like diabetes insipidus, dehydration, and kidney damage. When looking at a lab report, a normal result is generally seen as 1.010 to 1.025, but your healthcare provider can guide you on what's normal for you. Next, we have glucose. Usually, there is very little to no glucose seen in the urine. Glucose is reabsorbed from the urine, back into the body, but when glucose is seen in the urine, there is more glucose than can be reabsorbed. An increased urine glucose can be a sign of diabetes. There are non-diabetic conditions in which high urine glucose can be seen in the urine, but these conditions are uncommon. Moving on to urine protein. In a healthy individual, urine protein may be seen in traces or not at all. The presence of protein in the urine, called proteinuria, is usually divided into 3 phases: pre-renal proteinuria, renal proteinuria, and post-renal proteinuria. Pre-renal literally means before the kidney. In this case, pre-renal means before the urine has reached the kidneys, while post-renal means after the urine has left the kidneys. Pre-renal proteinuria is not usually indicative of kidney disease, but rather that the evidence of protein seen pre-renally is either transient, or the protein could be from a condition seen in multiple myeloma. In cases where renal proteinuria is typically seen, there has been some kidney damage or damage in the tubes leading into the kidneys or out of the kidneys. If post-renal proteinuria is seen, this may indicate that there is some damage in the bladder, in the ureters, the tubes going from the kidneys to the bladder, in the prostate in the male, or in the vagina in the female. The causes could be bacterial or fungal, or possibly from blood that is excreted during the menstrual cycle. Prostatic fluid and spermatozoa can also contribute to protein seen in the urine. Alright, let's look at ketones. Ketones are end products of fat metabolism. Generally, ketones in the urine, or ketonuria, can be seen when carbohydrates have decreased availability to be used by the body. Starvation or frequent vomiting can generate ketones which are excreted into the urine. On the other hand, ketonuria can be a red flag for diabetic ketoacidosis, when glucose, as a source of energy, is not being used as energy by the body. The lab scientists also examine bilirubin and urobilinogen levels. Elevated bilirubin might suggest liver disease or obstruction of the bile ducts, while an increased presence of urobilinogen can result from liver dysfunction or hemolytic anemia. Hemolytic, referring to the destruction of red blood cells, and anemia, referring to a lack of blood. There are a few causes of hemolytic anemia and liver dysfunction. If you want to know more about either of those, click that like button and a comment down below that reads anemia. Next, the microscopic examination of urine reveals cellular and structural components, providing invaluable insights into a patient's health. Let's start with red blood cells, or RBCs. Increased RBCs in the urine could indicate a variety of kidney disorders, a bladder disorder, a urinary tract infection, or from the menstrual cycle. A chemical on the urine dipstick pad will change colors, and this color change will indicate the semi-quantitative amount of RBCs in the urine. There is a caveat here, though. Although a dipstick may indicate that RBCs may be present in the urine, there may be a reduced number of RBCs seen or no RBCs seen. This occurrence may be due to the RBCs lysing, or breaking apart. C. The cell wall of an RBC allows fluid to flow in and out of itself, but if there's too much fluid that moves inside the red blood cell, then the cell wall ruptures, and this rupture is called lysing. The scientist will discern from the dipstick reading, the microscopic examination, and the preliminary diagnosis whether there is truly RBCs in the urine or if the RBCs have broken apart. Let's talk about white blood cells, or WBCs. WBCs are another indicator, especially when it comes to diagnosing infections. A chemical pad on the dipstick will change color to indicate whether WBCs are present in the urine. This will lead the scientist towards performing a microscopic examination to search for WBCs in the urine. A microscopic examination helps detect the presence of WBCs in urine, confirming that there is some sort of urinary infection. Epithelial cells, found on the skin and in the lining of the urinary tract, may suggest inflammation or kidney damage, or it may be simply that the patient did not perform a clean catch correctly. Casts may also be seen in urine. Casts are tube-shaped particles, made from a protein called uromodulin, can be indicative of different renal conditions. And there are many different types of casts, such as hyaline casts, granular casts, RBC casts, and WBC casts. The most common cast seen in urine, though, is hyaline. Crystals can also be seen in a microscopic examination of the urine. The lab scientist can identify crystals such as calcium oxalate or uric acid crystals, and urinary crystals play a significant role in the formation of kidney stones. Lastly, we explore the presence of bacteria and yeast in urine, which could signal an infection. Identifying the specific microorganisms helps determine the appropriate treatment for the patient, and additional tests further enhance the accuracy of urinalysis results. Urine culture and sensitivity tests help identify the specific bacteria causing an infection and determine the most effective antibiotics for treatment. Once all the tests are conducted, physicians integrate and interpret the results according to the signs and symptoms of the patient. By considering multiple factors and test outcomes, the urinalysis helps to form a comprehensive diagnosis and can assist the provider towards the development of a treatment plan tailored to the patient's needs. In conclusion, the urinalysis is a powerful tool for physicians, providing a wealth of information about a patient's health. The tests we explored in this video can help play a significant role in understanding the patient's kidney and bladder function and assist in diagnosing various medical conditions. These videos help to educate the patient when speaking with their provider, thereby empowering patients with more knowledge in being their own health advocate. If you got something from the video, please consider subscribing so that more videos will come your way, but at least, hit that like button, so the YouTube algorithm will send these videos to others. Thank you so much for watching this video, and we'll see you in the next one.